Hello, good morning. My name is Ben Evislage from FHI 360. We're still waiting for some attendees to join, and then we'll go ahead and get started. For any of you joining from Global Fund or UNAIDS in a coordinating role and would like to be promoted to a panelist, you can go ahead and raise your hand and I'll go ahead and promote you. Mateo, I see you. I'll promote you. And Eleonora, I see you as well.
Hello, Ben. Hello, everyone. Good morning, good afternoon, depending on where you are.
Hi, Mateo. You can hear me, correct?
Absolutely fine. Thank you.
Okay, perfect. Thank you. So we'll just wait another minute and then we'll go ahead and get started. If there's anyone else who's attending from Global Fund or UNAIDS who is in a more of a coordinating role, you can raise your hand or note it in the chat and I can promote you to be a panelist. All right. Well, let's go ahead and get started. My name is Ben Evislage. I work at FHI 360, and today we have a webinar on capacity building for virtual demand creation and also virtual health service delivery. This is one webinar in a four-part series, and this one is focused on the Eastern Europe and Central Asia region. And because of the diversity in the region and because of my own team's language limitations, we're hosting this in English. And currently there's no translation. However, if it's easier for you, we will be also sending this PowerPoint and some additional resources by email so you can review some materials on your own time. And if needed, use simple Google Translate or others if you need to get the content in your own language. Today's webinar is scheduled to be 90 minutes and we have time for Q&A. First, if you'd like to confirm that your first and last name on Zoom are correct, if you need, you can click on the participants window and rename if necessary. You can also introduce yourself in the chat. Make sure to select you're sending to everyone. You can put your name, where you're currently located, which country, and if you in your title, if you're a consultant or if you work for a particular institution, you can write it there in the chat. Just introduce yourself to the rest of the attendees. So attendees, if you're listed as an attendee, you'll be muted for the duration of the webinar. However, at any moment you can raise your hand and I can unmute you. So if you raise your hand, that will be my signal that I should unmute you. There will be some designated times during the Q&A, question and answer, or discussion session where I'll be looking for your hands, and I can easily unmute you so you can ask any question you'd like or contribute to the discussion. Additionally, you can always ask questions in the webinar chat, which I will open and review as well. And are there any other Global Fund or UNAIDS staff on the call who should be promoted to a panelist? I just want to make sure I've included everyone. Looks like I've included everyone. All right. If you would like If you are an attendee and you'd like to be upgraded to a panelist so that you can unmute yourself, just raise your hand. I'll go ahead and do that for you. And thank you guys for introducing yourselves in the chat. So before I get started, I'd like to give Matteo from the Global Fund or Eleonora an opportunity for any opening remarks. Matteo, would you like to start?
Yes, please, and thank you, Ben, and thank you to everyone who has joined us today. It's really a pleasure to be here with you all. As Ben mentioned at the very beginning, this webinar is the last one in a series of 4 meant for TSM consultants, but also for consultants contracted through other mechanisms, for instance, like GIZ backup, or even expertise council initiative, to support contracted to support countries in implementing demand creation online, demand creation through virtual services, and also to deliver health services online. So this webinar is particularly really to introduce a bit to the topic, understand a bit what are some of these approaches and what some of these mechanisms through which we can create demand online. The funding for this webinar comes from the Gates Foundation, which we thank, and through this collaboration with our colleagues at FHI. So just, the webinar will last about an hour and a half. I hope you can enjoy it. And I just wanted to, again, thank Ben and all our FHI colleagues for organizing this. Thank you so much.
Thank you, Matteo. Yeah, it's quite early for me. It's 5 a.m. So I might be missing some of the typical introductory remarks, but I think Matteo, you covered it all. Thank you. Eleonora, any additional comments or framing from you?
Yeah, thank you, colleagues. Thank you, Ben, for being such an early bird for our region. Highly appreciate it. I would not be able to make it at 5 o'clock, never. And I'm thankful to our consultants who managed to join this webinar. You know that our region is not actually on top of getting funding for the technical support. And all our potential consultants who are working in supporting the region, they are of great value, golden value for all of us. And we cherish this pool. And I'm grateful to the TSM team, which is supporting the pool of consultants. And with this understanding that every single of you are of great value for us, it's very important that you stay in this environment and stay abreast of all the developments which are happening in the area of technical assistance, so that we would have more options when pre-selecting consultants for the technical assignments, understand who is who and who is doing what, and all these updates. And I hope that we will refresh all of us through this webinar, and later hope it will serve for the better quality of technical assistance in the region. Thank you very much.
Thank you, Eleonora. Great. So let's go ahead and get started. I think the general objective was already described, and also specifically for this webinar. FHI 360, my company, my team has been engaged by the Global Fund and the Bill Melinda Gates Foundation with the objective of supporting Global Fund HIV programs, particularly, but Global Fund programs generally, to scale virtual demand creation and virtual health service delivery. So this is why we have these webinars, but we've also had some other deliverables and activities to support the Global Fund in this way. This particular webinar is part of that general objective, and it's to develop the capacity of TSM consultants, but also other consultants for supporting Global Fund projects on virtual demand creation and health service delivery approaches. So what do we mean by developing capacity? To be honest, this is only a 90-minute webinar. We don't expect that you'll necessarily be experts in telehealth and virtual demand creation by the end of the webinar, but our objective is that you would be oriented to relevant approaches. You would have a better capacity to navigate what are the different approaches, and you would have better knowledge on how to decide when certain approaches might be better than others to achieve certain outcomes. And maybe most importantly, after the orientation of the approaches, is that you'll have this guidance available to you and additional resources, so that if you are called upon to support a program to begin planning virtual interventions, or it includes that topic, that you will have some examples from other countries, relevant guidance and tools. And lastly, when this webinar ends, FHI 360, myself, we are still available to support you. If any of your countries that you are linked up with to support include virtual interventions, and you want to learn more from us about our experience implementing these in other countries, or receive more guidance, we can meet with you individually. We can provide you some guidance. We can assist you in your preparation for any future technical assistance you might provide. And we're available to do that for the next 4 months or so. So feel free to reach out if you have any questions, even after the webinar, or if you want some additional assistance. So here I'm just highlighting some of the previous deliverables that we worked on the same project. We have a budgeting and programming aid that was developed for virtual HIV interventions, and this would be very useful for you if a program that you're working with wants to understand how much do these interventions cost, and what are some other considerations about the interventions. A lot of it has been put into that guidance. We had similar webinars for the LAC region, Latin America and Caribbean region, earlier this year. We did a report just last November, focusing on all of the Global Fund and TSM eligible countries, looking at their internet, social media, mobile use nationally, assessing existing virtual interventions and platforms in country, and also looking at the funding requests, the Global Fund funding requests, and identify which countries have proposed virtual interventions. So that report essentially prioritizes certain countries, certain Global Fund countries, for technical assistance and for virtual interventions. So within the EECA region, I believe there were 2 countries, and the names are missing me right now, but we have it here. Yeah, it was Kyrgyzstan and Ukraine among the full list. But most countries in Eastern Europe, including most of Central Asia, have pretty high social media, internet, maybe more particularly internet and mobile phone use, and are relevant places to consider virtual interventions to reach and engage clients in health services. So this slide is mostly background. And here's our agenda. I'll be so we have 20 minutes dedicated for the opening. We now only have 5 more minutes for the opening and technical overview. And then we jump right into virtual demand creation as the first main topic. And then we have some Q&A. And then secondly, we get into virtual health service delivery, and then a Q&A. And then we have some time to guide you with some additional resources. So let's get started with a quick poll. It can be just 3 questions. See if I can pull it up. Yeah. So I've just opened a poll, which will have 3 questions. You can go ahead and respond to these questions now on your own device. You should be able to see the poll. If for any reason you cannot, you please write it in the chat. The first question, how would you define telehealth? So I presented 3 options, and you can select the definition for telehealth that you think is the most accurate. And the second question is your confidence in being able to provide technical assistance on telehealth or related approaches. Extremely confident as a 10, and not confident as 0. And obviously, any response is totally adequate. There's no correct response there. And the last question is your open feedback. You're all here. Thank you for joining. But if you have any particular areas that you'd like to learn more about during this webinar, things that you're interested in, you can go ahead and put it onto the third question. And it looks like just 13% of us have responded, now 18%. I'll wait until we get at least 50. So go ahead, take your time. Looks like we have 40% who have completed the survey, 45, okay, 59. I'll just wait a 68. Looks like most people are pretty engaged. That's great. 72. Looks like someone dropped out. Back to 69. All right. 82. Pretty high number of responses. That's great. I'll wait just another few seconds and then I'll close. And if there's something, if I end the poll and you haven't responded fully, you can feel free to use the chat to contribute, especially for that last question. All right, let me go ahead and end the poll. I can show you the responses. Okay, share results. I do hope that you're able to see the results of the poll we did. You'll see under the first question, how would you define telehealth? There were 3 options. The first, the remote diagnosis and treatment of patients by means of telecommunication technology. Okay, so this is actually a definition used for telemedicine, and telehealth is a broader category, and telemedicine is within telehealth, and it's a more narrow category. And telemedicine is very specific about remote diagnoses and treatment. Let's look at the second option. Telehealth, the provision of healthcare remotely by means of telecommunications technology. So this is a definition of telehealth that some use, and it's quite broad. So any kind of healthcare provided remotely applies to telehealth. And for my team, we always include health communications like demand creation as part of telehealth. So the second option is the most relevant for telehealth. And the third, the remote video audio consultations that take place between a patient and a clinician. So this is an example of telehealth, or yeah, and this is a definition for a virtual consult, like a virtual medical consult. So yeah, those are some of the, oh, you can't see the results. Let me just ask quickly if some people can see the results of the survey. I can see my own results. Okay. It looks like for some people, they aren't able to see the results. I'll just go through them. Question number 1, 10% of respondents chose the first option. That was a definition for telemedicine. 55% chose the second question. And that was a definition for telehealth, and 35% chose the final question, which was for virtual consults. All right. Number 2, how confident are you in your ability to provide quality technical assistance to Global Fund programs on telehealth and related approaches if asked? 11% say 10, extremely confident. That's 2 people. That's great. I'm so excited that there are experts in the room. We have another 2 people that are either a 9 or 8. So that's a good 4 people that have have significant expertise or they're very confident in their abilities. That's great. We have several in the middle. 4 people are at a 6, 2 people are at 5 and 4, and 4 people are at 3, and 2 people are at 0. They're just not confident. Okay. So this webinar is probably meant more for people that are below 7, or who have expertise and confidence, but might want to learn a little bit more about these approaches from other countries, other regions. We have some examples here. And let's take a look. I'm taking a look at the responses of the poll for the last question. What are you most interested to learn about during this webinar? Write a few short examples. Someone wrote selection criteria, contracts. I'm not sure exactly how that applies to telehealth, but if you want to add in the chat, selection criteria for who, we can respond to that. Someone else said indicators for monitoring web outreach, how to evaluate non-tangible results. Okay, that's a very good point. Yeah, let's, as we get into the presentation, you can ask some questions there. I'll give some examples of how to monitor results from virtual engagements. Listen about best practice, perfect, you're in the right place. Ethical aspects, evaluation of such interventions. Ethical aspects, great. I don't think the slides are covering comprehensively the ethical aspects, but we do mention them and we can bring up more during the discussion. Different approach in working with different groups, language and technology issues. Yes, very important. I think that's another one where we need to adapt the approaches to various audiences, and let's have that as part of the discussion. Telehealth in prisons, quality assurance for telehealth services. It's all very, very great questions. I don't think we have any examples of telehealth in prisons within this particular webinar. It's something that I can look into afterwards. I'm sure actually others on the call might have some examples from the region to share as well. Aspects related to HIV and TB, virtually delivered interventions. Okay, great. So let's go ahead and jump back into the presentation. All right, I just need to close the poll and we'll go ahead and keep. So we just have a couple minutes. I want to give a quick technical overview of telehealth approaches. So why would programs want to go online? Why would they want to introduce telehealth? Some of the typical reasons are to expand the reach of health services and products by connecting with the growing mobile generation, people who have phones, right? And maybe some audiences who would be hard to reach through the traditional hotspots or some other physical networks or locations. The second is that the use of virtual platforms can improve efficiency. 1, through enhanced targeting. 2, through broader dissemination of communications. And 3, through self-care. So virtual platforms can allow clients themselves to find information, find health services, and engage in their own care as opposed to relying on another person to deliver all that to them. The third is that it can help meet client preferences. So many clients that you might reach online, prefer to engage with health information and services virtually as well, because it might be more convenient or a little bit more discreet for them. And the final is that virtual health service delivery can help develop the resilience of the health system to withstand shocks such as COVID-19 or others where physical service delivery might have been limited. Some relevant trends to note, the mobile connectivity globally is quite high. I mean, we can't compare with other planets, but it has been increasing every year. And you see here 58% of the world's population is connected by phone. 64% are online. And you can also see here by region, Eastern Europe, 86, almost 87% internet adoption, Central Asia, 70, almost 73%. And so quite high in the region here. Some other things to mention is that at the same time as higher mobile penetration and mobile use, there's been some alarming security concerns for key populations, LGBTQ, important target audiences for HIV programs. This has been particularly the case in some countries in Africa, but I think just globally, the expansion of social media has brought some additional exposure to some of these populations, and so there's additional risks to consider, especially for these populations. And with many more people using the internet, accessing information and services that way, many countries are beginning to introduce more strict data privacy laws and some restrictions on certain social media and apps, which differ by country. And this is important if you're supporting a program in a country where they have a strict data privacy policy, that the program is compliant with those policies. And you can see, like, Europe all has legislation in place for data protection. The GDPR is the policy there, for at least for Europe. And many other countries in Central Asia, Africa, and others often look to the GDPR as their standard, and they've begun to introduce very similar approaches, very similar policies. Sorry. So here's a framework for telehealth, and I'll be presenting the framework in a couple phases. So this framework shows approaches for virtual and telehealth across the client care continuum. The series of steps you see here is based on the HIV services cascade. However, they were adapted to be a little more broadly useful beyond just HIV. The process begins on the left-hand side, where health service delivery programs plan their virtual interventions. They then continue to use approaches to reach their target audience online, then refer those clients for health services, deliver those services, and re-engage those clients over time. This process continuously uses data from each step to monitor outcomes of interventions and improve program performance. I'm going to show you some of the approaches below. Here are some of the categories for the types of virtual approaches and tools you can use across this framework. You can also see in green a category called self-care, which means that clients can use digital technology themselves to find, access, and stay engaged in health services. Here are some of the major types of virtual interventions that you can use across each step. You can see 3 major items appearing under the reach category. That would be your demand creation category. So we're going to review those under reach in the next part of this webinar, just in a few moments. And finally, here are a few more specific virtual approaches related to the first set that I mentioned. So this provides a general framework. This is not giving a framework for digital health. It's not giving a framework for broad virtual interventions. It is very focused on the use of virtual platforms to reach and engage clients or beneficiaries. So that is this whole continuum. It's about reaching, engaging project beneficiaries. We don't have examples in this presentation about use of virtual platforms for other approaches that do not engage beneficiaries, such as electronic medical records that don't engage beneficiaries, such as virtual training of healthcare providers that don't engage beneficiaries, all those kinds of things, management, training, those are outside of the scope of telehealth and outside the scope of this presentation. So we'll get started. I'm running 10 minutes late. This first section is on virtual demand creation. So we'll give you a little bit of an orientation to the approaches, both for how to plan these virtual demand creation approaches and how to implement them as well. So the first subsection is on planning approaches. We've designed a couple of approaches and tools that are helpful for planning virtual demand creation. And a lot of these tools aren't only useful for planning demand creation, they're useful to plan your entire telehealth approach. But first step after planning is create demand as well. So they are linked. And you can see the approaches listed here. One is called a situational analysis of virtual interventions, also called VISA, online surveys, social media mapping, audience learning, and implementation roadmaps. And we have some examples that we can share. So the VISA is going to be a report that analyzes the status of existing virtual interventions and platforms that's related to the target audience and for the particular health area. It involves like a desk review, web and social media search, and some stakeholder interviews. And these VISA reports help bring all stakeholders in the country together to understand what has been done in the past, what are the gaps related to virtual, and it gives some space to make some recommendations moving forward about how virtual interventions could be scaled and to not duplicate on existing work. Reports such as this are probably the best way to start technical assistance on virtual interventions for global fund programs. So it gives you a great baseline. As a consultant, if you're a consultant, it gives you a great baseline, and it gives the country a great baseline of what's going on, how to compare maybe with other countries, who could be reached online. There are some examples of existing VISA reports we've developed in different formats, and you can see them linked here. And we'll share these slides after. Social media mapping is an approach that's very targeted to provide inputs to your team that's going to be doing demand creation. The inputs it provides to that team. So this would be, the example would be, there are community partners in a certain country in Eastern Europe, for example. They do demand creation for their HIV services, and they want to know where they can reach their target audience online. So the social media mapping is an activity that provides those organizations a list of virtual or online places where they can reach their target audience. The mapping activity is done as a workshop with community members, where they search for and find and list these online places where they could reach members of the target audience, including social media groups, pages, social media influencers, group chats, where each member of the target audience is most likely to be reached. And it's documented on an Excel document. The tool itself provides some strategies of how to search for and find these groups. Something to note here is that depending on the country, such mapping and the resulting Excel document that has a list of these groups and pages might be sensitive, and it might be insecure to have that data. It depends on the context, particularly if you're mapping like social media influencers or WhatsApp groups related to MSM or transgender individuals or even sex workers. All of that information about the groups and pages and influences where you could reach them online in the wrong hands could do a lot of harm. So something to keep in mind. Each country is going to be different. If you have any questions about this particular approach, you can let me know. But the whole approach is using publicly available information, but it's also using some community knowledge to get the first entry point into the online community. Quick online surveys is another method. We have designed a survey around 30 questions. And the point of the survey, the purpose, is to better understand who are these online audiences that we want to reach? The assumption is that these online audiences have not been reached very well by the existing programs, and they're not represented very well by the existing community organizations. So if that assumption for your country or your HIV program you're supporting is correct, then they would benefit from learning from this online audience that might be distinct. The survey is anonymous. We use SurveyMonkey. It has around 30 questions. It asks about their use of technology, HIV risk profile, and most importantly, it asks about their preferences of how they want to receive HIV information and services. So this is going to be what the program uses to design their virtual intervention plan in a way that aligns with the preferences of this online audience. We have some examples, including the survey tool itself available here. In the next few slides, we show examples of the kinds of questions asked on the survey and why they're important. So here it says, how do you normally prefer to communicate using your phone? This is talking about like which types of media are preferred by the audience. So, you know, messaging, SMS messaging, voice call, video call, email. On the right-hand side, what topics or issues interest you on social media? And this is open response. And although it sounds like this is like not a very interesting question, the purpose here is to be able to get a fuller sense of the target audience's interest on social media. And this would allow you to align any social media campaign that you do on HIV with another related topic that is actually the most interesting to your audience. So you can see here, I mean, politics is a hard one to do any campaigns around. Usually we try to avoid that in health. But as an example, you see mental health here as important. You see dating as important. So if your HIV program wants to create demand for HIV with this audience, they might want to bring in some of these other very relatable topics for the target audience. Dating, current events, music. Yeah, this isn't like very specific, but it gives you some examples. You see here which health services most interest you. This is really important because it looks like the target audience is most interested in sexual health and then very popular mental health. So there's a very strong rationale to combine the messaging, even combine the programming to offer both. And that can help boost your results of your demand creation or your virtual demand creation. And here are some other survey questions and responses, and you can understand how these might be important to help guide any new program design, any new telehealth program design. There's some other interesting planning approaches mentioned here, and you'll receive these slides. A lot of these approaches we're not using as commonly. The first one is still quite important. If you are going to support a community organization to begin reaching new audiences online, they're quite distinct in terms of typology or preferences or interests. It's always great that you engage them in the program so that their unique perspectives and voices are heard. Community advisory groups can be an example. I'm sure there's other examples as well. And the last planning approach is a roadmap, or you can do a demand creation plan or strategy. So either of these are very practical. They're talking about your next steps. They're talking about the actual implementation of demand creation, linkage to services, etc. And it's going to reference all the prior planning approaches and their results, like the survey, the social media mapping, the visa. It will use that data as justification for the decisions made in the roadmap or the strategy. We have some examples about these types of strategies. I see, Matteo, you're connecting to audio or you have your video on. Let me know if you'd like to speak. No, okay. Next subsection is reach virtual demand creation approaches. We have 4 main approaches. I'll go through them very quickly and we'll have time for Q&A. So we are presenting these different demand creation approaches by the kinds of staff that might be implementing it. So you see here on the top, you have these 4 categories: social media officers, social media influencers, online outreach workers, and community mobilizers. So those are like 4 categories of people that can lead demand creation approaches. And you can see below all these emojis, which kind of represent the online audience. So I'll go through each one. So for social media officers, they can implement 2 approaches: organic or inorganic campaigns. So organic reach involves managing and growing a following on social media among the target audience through posting interesting and engaging content. You can see here that the social media officer has that Facebook icon, which means they have a Facebook page. They have a set number of followers, and over time, they can grow those followers by engaging their audience to refer others, posting very interesting content that can be spread among the community and outside of followers to then attract more followers over time. Inorganic reach involves implementing paid advertising campaigns on social media, can also be on dating apps or search engines. And this is where you can reach basically all target members that meet the defined characteristics and that are using that platform. The defined characteristics might be gender, age, location, topics of interest, and others that help refine who should be presented with the ad. So the people reached via this approach can be linked directly to HIV services, such as through a WhatsApp call line, or linking to a online appointment booking application for clients to just book, or clients that are reached on inorganic or paid advertising can be linked back to the social media page of the organization, so that there, over time, more people can follow that page. And once people follow a page, your promotions to that audience are essentially free because they're already following you. They're already following your content. The next social media influencer promotions start by identifying individuals on social media who are popular and influential among the target audience and engaging them to post content to their followers about the program. People reached can be linked directly to HIV services, to the program social media channels, or the people that are reached by an influencer can be linked to an outreach worker, which is the next topic. And you can see here that 3 individuals have been identified as an influencer. Those, the blonde woman, the brown haired man, and the dark haired woman, they're each the influencers, and they each have their own reach. And many times for influencers that have a larger audience, their reach, their followers overlap a little bit, and that's okay. All right, outreach workers. So online outreach workers are hired by the HD program to individually support clients reached through other demand creation activities, and they support those clients to access services. They also reach directly into online social networks through peer referrals and through some known social media groups and pages where the target audience might be. So you can see here that the efforts of the social media officers on the far left are likely going to link individual clients for additional support to the online outreach workers. That's typically how we've structured this in some programs. And then the online outreach workers will support those individuals referred by the social media officers, as well as do their own outreach. So they might reach one client in the community who's online, and after they support that client, they'll ask them to refer some other friends. And so they can receive additional referrals that way. The last, community mobilizers. These mobilizers are members of the community. They have access to hard to reach segments of the target audience. So these mobilizers will contact their friends and help them access HIV services directly. And the HIV program may incentivize or give some kind of financial or non-financial incentive to these mobilizers based on the volume of clients they reach individually, or volume of clients that they result in getting tested. So this approach has been used by a lot of USAID PEPFAR programs. It's also called the Enhanced Peer Outreach Approach. And it's a very easy approach to implement virtually, because you can simply create links that the mobilizer can forward to their friends, and their friends can then book an appointment on that link. And each link can be tracked with a unique code assigned to that particular mobilizer. So then the program can see the results per mobilizer and pay them incentives or give them any other non-financial incentive, or track the results. So this is basically like assigning someone in the community to be acting like an outreach worker without all the training. It's just to like help them and their friends get in for services. We have some examples here. This is from Jamaica. Examples of an organization that started doing online outreach with outreach workers, as well as with a social media officer. And if you go to their Instagram page, it's a program focused on MSM in Jamaica, and they've really grown an online presence, and they've continued to find value in reaching clients online with this brand. You have some examples here of exactly what are their steps. The trained outreach workers go on dating apps and social media sites. They identify clients, engage them in prevention messaging, and they support them in accessing services. So they have a sort of structured approach to their engagement with clients. You can see here, these are the posts of the iFlex Jamaica page. This would be an example of social media officers managing content. And it's pretty good. Like you can see here, for Jamaica's not a huge country, and the MSM community is quite, I don't know about size, but it's a little more stigmatized there. And you have some examples here of posts that are more masculine and not obviously LGBT oriented, but you have a high number of likes and comments on these posts, which means some pretty good engagement. Here is an example of social media influencer campaigns. This is from 2018, when some local organizations with FHI 360 led a campaign in Jakarta called Update Status. And on the right is an influencer of Stasia. She's a transgender makeup artist. At the time, she had 166,000 followers. We hired a creative agency to film a few short, silly videos. In this example, she's just explaining, the experience of going to a clinic for an HIV test and making it seem not so scary. And this was posted to her followers. And also, FHI 360 reposted this video as well, and it's on its own accounts. So it was useful not only to reach her followers, but to create good content that the program could also repost. In Guyana, in South America, there's also some examples here of diverse ways of doing demand creation. Some social media influencers talking about online appointment booking for health services on TikTok. You see in the middle an organization posting about them using a new online appointment booking tool that clients can use, and then outreach workers on the far right supporting clients to book appointments. Here's some examples of social media ads that went out in Zambia for a global fund and UNAIDS project focusing on condom demand creation. So you can see the content produced here. A lot of these examples demonstrate the point that in order to create a presence online and use ads, it is important to have some skills in the HIV program on design, graphic design, layout, and copy. And copy means like the text you use to associate with your visual creatives. All those things are important to have good impact and to make your product look professional, your product or your service look professional. So this is just some examples here. And I'd like to open it up for some questions. This is the end of the first section on online demand creation. So if you have any questions about marketing, online demand creation specifically, you can add them in the chat. I don't see any questions yet. So yes, you can go ahead and raise your hand if you'd like to ask a question by audio, and I'll unmute you, or you can add your question to the chat. We have 10 minutes or so. Let me start by addressing a question that was added in the survey. Oh, hey, Matteo, you want to unmute? I still can't hear you.
Can you hear me now?
Yeah.
Yeah, sorry, thank you. I had a question related to social media influencers and their use. Do you have any experience with that, and how does that work specifically, more in detail? If you could maybe dive a little bit to that topic. Thanks.
Yeah, I actually think that online ads and social media influencers are very interesting approaches for HIV programs because they can achieve a lot. And I also think that they're the scariest for a program to engage on, because it brings a lot of exposure to HIV programs that in some settings have tried to hide from the exposure. So let me explain. So for our social media influencers, there's a lot of different ways that you can go about this. I think the easiest is for like a program to sit down and just ask themselves, for the people we already know, for the influencers, like the community members who already know us, who have a large following on social media, we can engage them. And then the program just needs to decide, what is our messaging to the influencer? What are we proposing that they say to their followers? And how are we going to track it? And how are we going to reward them for their effort? And the reward them for their effort can be many different things. For some influencers, it can be acknowledgement and the thank you, and showing them the results and the impact of their messaging. For many influencers, having a social cause that's aligned with the health or wellness of their followers is something that they want to do anyway. Those are probably the highest value and lowest cost influencers to engage. And I love engaging those because they do it for free. And not only do they do it, they don't always do it for free, right? Some people are an influencer as their work, so they might charge regardless, but they have much more passion for the topic. And they're closer to the community as well. So I think that's great. I think with any approach you take with influencers, you need to have a couple things in place. One, what is the ask of the influencer? How are you going to monitor their results? What's the pathway for clients that they communicate with? What's the pathway for those clients to then access the services? Need to define what's the objective, because the objective is going to help determine which influencers to work with based on their reach authenticity, and who follows them. If your objective is to reduce stigma and discrimination experienced by MSM, then it's likely that you don't need to engage too many MSM influencers. You might want to engage the general population, because they're the ones that might be impacting stigma and discrimination experienced by MSM. If your focus is, I want to increase HIV self-testing by MSM, then you definitely need to choose influencers that have a large following of MSM and who are very trustworthy and whose opinions and behavior are things that your audience are going to look at and want to follow. So there's all those questions you need to have considered. And then your strategy to engage an influencer is going to be very different depending on what level of an influencer they are and how closely you are already connected to them. So those that the program is already known about or are friends with, it could be quite easy. Those that they don't know very well might require a strategy in terms of, payment, or it might involve a way of presenting the program that's going to be appealing to the influencer as well. Because if you think about it, some of the influencers you engage are going to be, some of the influencers that an HIV program might engage can be very representative of the target audience. So as you engage an influencer about the health program and the objectives, they're likely going to have a lot of valuable information about how you should communicate that to your online audience or to the community, how you should package it. In many countries, we have engaged the social media influencers in our community advisory board because they're expert communicators. They know the online audience, and it's really useful to engage them. So I know that I mentioned a lot of items. Matteo, I think the last one I'll mention about influencers is like safeguards. Like one, if you have, some influencers might be able to just like post, basically repost campaign content from the organizations. Others are being paid. And so usually in a paid relationship, you have a contract and you should have some safeguards for the program in the contract, that the influencer doesn't speak on behalf of the organization necessarily, that you can end the contract at any time, etc. And what we also do is we invite all the influencers who are promoting the health service delivery to a WhatsApp group. And as they promote and they get questions from their followers, the WhatsApp group will contain HIV experts and program staff, so that when the influencers get questions from their followers about, oh, can I get HIV from a massage, or can I, all these questions can be directed to the experts, so the influencers can put the correct responses out there on social media. There have been times where social media is where influencers kind of reinforce incorrect messaging, and so it's good to be able to monitor their communications and support them through like a WhatsApp chat or some other channel to get them the correct information out there.
Thank you, Ben. That's super interesting. Really, really interesting. Thanks.
Yeah, I find it very interesting. I think in a summary and for the demand creation, you can think of each of these approaches as very, very different, and they do very, very different things. Online outreach workers, they're only going to be able to handle one person at a time. It's very slow, but it gives a great amount of trust and building rapport and relationship between an individual client and the HIV program. It is the most likely to have success of an individual contact reach to actually come in for services, right? But it's very like low volume, but it's high conversion. Social media influencers, because their reach and engagement and trust and authenticity range so greatly, so does the total number of people they could reach and the conversion rate. But typically they have like a medium conversion rate but their real value is that among the target audience, it develops trust and awareness in the program. So even when an influencer promotes a lot about a new HIV program, maybe all of the results of those promotions don't immediately result in uptake of services in that week, but it has generated trust and messaging and awareness among the target audience, so that when they are ready to uptake HIV services, they know where to go. They know how to book the appointment. And so it will make all of your later campaigns much more effective. And then the online ads are quite similar. You can reach a much higher number of people immediately. You have diverse options of the action clients can take. You can link them to your Facebook page. You can link them to a chat. You can link them to book an appointment directly. And the conversion is usually the lowest, meaning you can reach a ton of people, but the percent that actually go on to booking an appointment can be very low. And so often your value for money is going to look lower on the advertising side. However, similar with outreach, similar with influencers, if people see online ads for a certain HIV program, or like for the option to book appointments on a certain web app, is going to develop trust, like, oh, it's a real thing. Oh, it's a credible thing. And so they're aware, they find it more credible. And over time, when they're ready, they'll be more aware of how to access that service if they need it. And again, it just has the highest exposure in terms of reach with that method. All right. Any questions? Any other questions? You can raise your hand. I'll see it. I think I'll see it. And I can let you speak. I'm going to go ahead and look at the chat.
Yeah, there are a couple of questions in the chat, Ben. I was just going to say.
Tatiana asks, do you have any examples with data on how virtual demand creation interventions increase service demand? For example, percent increase in PrEP. Yeah, this is like such a great question. I think we prioritize the technical content to help you orient on these approaches, and we didn't include much on the data. We do have data, do have examples. I don't have them in the slides actually. So we will send you some, we'll send you two things after this webinar. One, the slide deck, and two, a Word document that includes all of the references of all of the tools and resources that we have available. And there are case studies and examples that have data on these approaches. One that comes to mind right now is online. So my team is supporting HIV programs in around 35 countries, including with the virtual interventions. And in each of those programs, they are doing physical HIV testing and outreach, and some of them are doing virtual. And each program is collecting data on HIV testing to show the impact of various recruitment strategies. One could be index testing, like client referrals. One could be hotspot-based outreach. One could be, other peer referrals like peer mobilizers, and one could be online. What we have found across all these countries is that usually the lowest case finding, but the highest volume of testing comes from hotspot-based or social network-based or walk-in the clinic-based testing. Those are some of the lower case finding approaches. And the highest case finding is usually index testing, which sort of makes sense. And then there's many other approaches, but the second highest is almost always online outreach. And what that means is that, a lot of these programs are finding that when you go online, you're tapping into a new network that you have not been reaching through in-person or hotspot-based outreach, and who have not been engaged in routine HIV testing before. So you're finding it's an untapped community, it's an underserved community. Even if they're maybe more privileged, like they have access to a mobile phone, et cetera, it's still a community that is going to benefit from the HIV testing, and the case finding is higher. So we do have that data. We do have, particularly in Asia, a multi-country analysis in Nepal, Thailand, and Philippines, which discusses the value of virtual interventions, particularly demand creation for HIV testing. And HIV testing is usually the entry point for additional services like PrEP. So you will see that when you receive the resources. Apologies, we didn't have much data on these slides, more like just technical overview. And Jelena, or Helena, depends on how you pronounce, has a question. Is there experience with AI in the context of demand creation? This is such a great question. So one option, AI, is generative AI can be used to generate the creative content used in online ads. So an organization might not have the skills in graphic design or have access to download stock photos or other kind of content. Sometimes there are laws or what's it called? There's some sensitivity around using people's real faces in advertising for HIV. For instance, if you use a stock image, which is generally understood as you can use it for any purpose. In some countries, it can be quite sensitive because that person might reach out to you and say, don't put my face with that, right? Even if they sold the rights to that image. So generative AI can be somewhat of a solution here. Generative AI, I forgot the name, but there's a website where you can describe via text what you want to show in a photo, and it will generate the image. And obviously all the people in the image are fake people. Well, they're AI generated people. So they're not, necessarily look like anybody else. So that can be examples of how AI can support demand creation, is that AI can actually produce the visual content. I do think that AI generating content only goes so far. I think it can look a little tacky if an organization, all their content is AI. It doesn't look that engaging or real. But for some types of content, I think it's important, or it's a good option. And our program hasn't used that in our official ads, but we have tried it just on our own site. We've tried it internally, but we haven't posted ads with that content. But it's an option. Other ways to use AI, there's a lot in the space of marketing and targeting your audience online. I don't know if they're using AI or just really detailed, advanced logic. There's some options with Facebook of how to do interesting marketing. I'll give you an example. We've used this a long time ago, but if you have in your program, your clients that are enrolled in your program and you have their phone numbers, Facebook has this method that if you upload the phone numbers of people that are already part of your project and you upload it to their ad manager, the system will, in some kind of anonymous way, it will find the associated Facebook profiles for all the clients that, with the phone number you've uploaded. It will do an AI analysis to identify the common traits of that audience. And then it will use those common traits to do targeting of future ads to what they call a lookalike audience. So it's going to basically post ads to an audience that looks like your existing beneficiaries, but of course there'll be new people. So that's kind of like a use of AI. I'm actually not sure if Facebook still offers that targeting function. We don't really use it anymore. There's a lot of limitations in the last several years on using Facebook to target more criminalized or stigmatized audiences like MSM or sex workers or drug users. It's just not many options to do the targeting very well there or very easily. But those are some. those are some options of AI. I'm sure that there's a lot of other applications for AI use in demand creation. If there's other examples or specific specific examples you want me to discuss, you can put it in the chat. But I will say that I'm not an expert on AI. I am following it, but I don't think that we have all the examples for you from my team on AI. All right. It looks like there's no hands raised and there's no more questions. I'll go ahead and continue. This next section is focusing on virtual health service delivery. And so this is an orientation on approaches for online appointment booking and client management for health services. Some of the approaches here include client-facing online appointment booking. These can be on websites or apps, virtual consultations between a client and a provider, provider-facing appointment management tools, SMS or other messaging to engage clients, virtual case management. And we have an example of an application that we've used that actually facilitates all of those functions. It's called Aura or QuickRes. We'll highlight that. So client-facing appointment booking. This is really, really useful for programs doing online demand creation. And the reason why is you can easily, post your content online, and then how do you track results? Right? It's a super important question. So for us, we use an online appointment booking platform that we always link to the online ads so that we're able to track for each ad that went out, how many people booked an appointment or requested a service on the site. That's why you see here under key functions of these appointment booking apps, the last one is that it has a function to track the referral source. On our site, we have these codes that are embedded in the link, and we put that link with that code in the online ad, or we assign it to the online outreach worker, or we give it to the social media influencer. So they each have their own unique link that all directs clients to the same website. And when they book there, the site is going to track that, how the client got in. Another option, which is common, is if you don't have tracked links, you can just ask on the page where a client books an appointment. You can ask, how did you learn about us? And they can provide a couple of options. And that's another way for clients to report, what caused them to come here. It's going to give you some information on how your marketing efforts are working. We've provided some additional functions that are going to be useful for online appointment booking applications. This should be easy to navigate, easy for clients to find relevant providers, useful if there can be filters. So clients can navigate a full long list of providers by saying, okay, I want to receive this particular health service in this area, and maybe by this modality. Maybe they want it delivered, or they want it as a virtual consult, or they want to actually go to the clinic. So having those options will help them. Another item is that you can allow clients to request a service, which means they're going to submit a request for, like, say, HIV testing, but it's not assigned to a specific clinic or provider. That's one option. The other option is you actually add your providers to the system, and you add each provider's appointment availability. And that way, when clients book, it is directly added to the provider's calendar, and there's no double booking of appointments. So if I book for 9 a.m. tomorrow, and you also look, 9 a.m. won't be available to you because I've already booked it. So this kind of like calendar scheduling functionality on these systems will help both the client and the provider, manage the service access. Also needing to ensure that if you're collecting client information, that it's done securely. So if a program is offering that clients can book appointments for health services online, it's usually required that some kind of contact information is collected from the client, maybe so that the provider can call the client, for a virtual consult. They need that contact information. Or two, if the client misses an appointment, to be able to contact the client and reschedule. Or three, the contact information can be collected so that the system itself can send automatic reminders to the client about their upcoming appointment. So those are just some important considerations if programs don't have an appointment booking app, or they have one and they want to enhance it. Another function, another approach can be virtual consultations. So this is where clients meet with a provider virtually to receive a consult-based service. So this consult-based service can be pretty wide-ranging. For mental health, many, if not most, of these consults can always be provided remotely or virtually. As long as there's a strong internet connection, I would recommend video is useful for this, but not always required, but still useful. That can include psychosocial support and even enhanced adherence counseling for clients on ART. Some other programs like the online outreach workers, instead of the outreach workers going to the field and meeting with clients to provide them prevention messaging, in Mozambique, the online outreach workers, they reach clients online, and then their first step is to schedule a virtual consult between the outreach worker and the client. And that session is meant to provide the HIV prevention education information to the client over the phone and help navigate that client to services. So they use virtual consults in that way. It's not a medical clinical service, but it is providing education and information and service navigation. So to help manage virtual consults, we have some bullets here, which are useful functions or items to consider. Using an online booking platform is very useful because the providers can set their availability and avoid double booking. Programs should decide, what should be the default platform to host a virtual consult. Maybe it's WhatsApp, maybe it's a simple voice call, maybe it's a telehealth application. WhatsApp has been the easiest for most of our settings. Automated appointment reminders sent to the provider and the client that include instructions on how to open or start the virtual consult. So like an SMS or message that goes out 15 minutes before the scheduled call, and it can include a phone number to call or a link to join the virtual consult. Providers should have some kind of back-end access to view their schedule of appointments, and this would help them prepare for any appointments booked for today, help them to reschedule appointments as needed. And there's some other functions here you see that are going to be useful for the provider. I'll go to the next slide. This is an example of like a back-end provider-facing appointment management system. So what this will show the provider is all the appointments or requests that came in from clients. So, here, this view is showing you at a particular clinic for today's date. Let's just assume it's November 24th, all the appointments scheduled for today. And in this clinic, you can see that all the appointments for today are at the same time, which means that there's, multiple providers at my clinic that can handle these clients. Otherwise, you would say you would only limit one appointment per time slot. But this kind of interface is going to give the provider or clinic staff a view of all the upcoming appointments to help them reschedule or edit. They can report when clients arrive. You can see the little arrive button in the middle, the green one. And so that, for the appointment scheduled today, it's arrived, or it'll show if it's missed. And it also gives an interface to report what health services are delivered during the appointment. And programs can decide if they use an interface like this to report health services delivered, or they just use it for appointment management and they do not use the health service reporting. Many times they have another system to report health services delivered, like an HMIS. And you see here as well some safeguards related to the client phone number. You see the little phone number in near the bottom for each client. It is covered with an asterisk, but if you hover over it, the phone number can be revealed. So there's some safeguards there. And these are just some considerations for how to build or structure a provider-facing appointment management system. You might be in a position to help a program review some options for these applications. And sorry, let me go back. I think I've skipped over a lot of content. Yeah, sorry about that. You might be in a position to review several applications that could be used for appointment management. And these slides are just going to give you some important factors to consider if the functions are available on those platforms. Here, engaging clients through SMS and other messengers. I have listed on the left-hand side some types of messages that would be beneficial for programs to send to clients, like appointment confirmation, reminders, links to provide feedback on your appointments, links to like an online client referral portal, other messages to re-engage clients, maybe a SMS message for people who have booked HIV self-test kits to report their result. Lots of options there. You can use an automated method. If you have an online appointment booking website, then that website can be connected to an SMS vendor with an API, and all of these messages can be sent individually to clients based on, as soon as their appointment is booked, the appointment booking app can direct the SMS vendor to send the confirmation to the client. And that is a great way to send messages to clients in an automated way. The other is that program staff can have a list of messages and send them to clients manually when they know the client is eligible for that message. For instance, clinic staff can see they have 10 upcoming appointments tomorrow. They're going to manually send a reminder to each one of those instead of doing it automated through an API. Very important to consider the channel used, SMS or WhatsApp or others. And this isn't like comprehensive guidance, obviously, but some general guidance that we use for this kind of messaging. Obviously, clients should opt in to receive these messages. They should be given an ability to opt out at any time, and simple instructions on how to opt out. And we exclude sensitive health information from within the messages. So I'll give you an example. On the left-hand side, number 7 and 8 could potentially include sensitive health information. So number 7, you want to notify the client that their viral load test results are ready. So our message says something like, your test results are ready, contact your provider at this phone number. So it doesn't say what kind of test, it doesn't say viral load, it doesn't say the result. It just says test results are ready, contact your provider, here's a phone number, they'll tell you about it. Number 8, if the client has low ART stock, the message says, are you running low on your medication? If you'd like to book a refill, click here. And they have an appointment booking link to book a refill. So it doesn't say it's ART, it doesn't say it's for HIV, it just says medication. So that's typically how we frame those kinds of messages. Running low on time. So I'll try to breeze through these quickly. Virtual case management. This is particularly useful for clients on ART or maybe PrEP. And it's an individual relationship between clients and case managers. And this is a common approach in many countries, but sometimes the case manager can be a community member. Sometimes it can be a clinical staff. The use of virtual platforms here is wide-ranging. It could be that the case manager is helping clients to book appointments for all their health needs on an appointment booking app. It could be that the case manager is supporting the client through phone calls or WhatsApp calls instead of meeting them in person. It could be that the clients receive their reminders to attend their appointments by SMS, and the case manager might have like a software or an app that keeps track of their clients and provides them a way to visualize the client service access and reach out to the client if they need additional support. So there's some examples here, the links you have. There's a webinar on case management. There's a video that demonstrates how case management is done for ART on QuickRes, in case you're interested. And yeah, there is an application that is available that actually has all these functions. I think it's a great resource. If you were to meet with programs and they wanted to learn more about ways to do this, I would say we can provide you all the information about QuickRes and Aura because we developed it, and you can use it. It'll be useful because it provides a good baseline of what could be done. It's not that, you know, necessarily that they should use QuickRes. It's just available to you. We have resources for it. So it's a great way to kind of review the functions with a program and see if it's a good fit. And I'm sure that there's other software and programs as well that you can use. So I'll just mention here that Aura is called the Online Reservation and Case Management App. That's the name of the software. And then we deployed that on a website called QuickRes. And QuickRes can be used by many countries and programs at the same time. And right now, like 33 countries are using one of these software. And for a range of health services, HIV, STI, family planning, violence, mental health, COVID-19 services, and postnatal care and early childhood immunization services. You can see the countries here that are currently using or planning to use Aura or QuickRes. This is a reference slide. You'll get the slides, you'll be able to see this, but this shows what are all the functions on Aura or QuickRes across the client care continuum. You have on the top the functions that are used by clients themselves, and the functions below which are used by providers or program staff. So this is the reference slide. The main point here is that it's quite comprehensive. It includes a lot of what you would need to engage clients virtually in health services. You can see here the interface for clients to book appointments. Some very important considerations if a program wants to use Aura or QuickRes, but I think these are important considerations that they would need to review for any kind of application for online appointment booking or case management. Does it comply with local and national data privacy laws? How is this going to serve the needs of clients, providers? How would a system like this integrate with the existing health systems? What financial and human resources must be deployed to roll out an application like this? And what, you know, expert technical assistance might be required to properly use such a system? And I know that we're at time. I'm going to do a quick check to see. I think I have a very full morning and other webinars. Not webinars, I have another meeting. Well, I have another meeting that I have to attend on time. Let me ask very quickly if there's any important burning questions. You can feel free to raise your hand. We can address it very quickly or put it in the chat. Give you a few moments. No hands raised. All right. I will recommend, if you have questions based on any part of this webinar and the content, you can reach out to us on email. Let me put the email, where is it? Yes, you can see the email on this page at the very bottom, goingonline@fhi360.org. Please go ahead and send an email there. any of your questions and I'll respond. I put that in the chat. And I'd like to thank you all for your time. And I apologize for ending this webinar without sufficient time for our second Q&A. And I'll invite Matteo if you have any other closing remarks.
Yes, Ben. No, thank you. It was just really an opportunity to say thank you to everyone for connecting today, and thank you to you, Ben, really for great presentation. You know, both parts really enjoyed it. Thank you so much.
Great. I'm glad that this was useful. As a next step, tomorrow you will receive some materials, this PowerPoint, and also a Word document full resources and links to resources across all of these approaches. And I want to thank you for your time, and I hope you have a wonderful rest of your day.